In this video, Dr. Gabor Maté discusses the connection between autoimmune diseases and suppressing emotions. What is the lifelong impact of having a childhood trauma?
Trauma affects how you feel about yourself. Generally, the child takes things personally. When bad things happen to the child, they believe it's because they're bad, so they have a lifelong sense of shame. Trauma affects brain development. So the brain circuits that regulate the emotions, stress, body modulation, social relationships, insight, self-regulation, impulse control. These circuits physiologically are distorted in their development under conditions of trauma. And then trauma also gives a person a sense of a world where they don't belong, where they're not safe, where they're not going to find help, and where they have difficulty trusting other people, or on the other hand, they trust some people too much when they shouldn't. So it distorts development in multiple ways. And these effects can be lifelong, and they can lead to physiological and mental illness.
Is it inevitable that someone who has experienced childhood trauma will encounter problems?
It's not inevitable, but the more trauma or the more difficulty you experience, the greater the risk of these problems accruing and then cropping up in adult life. Now, if a child has a traumatic experience, but has a nurturing adult or a trusting mentor or a trustworthy mentor, that can mitigate the trauma and promote resilience. But what we can say is that the more negative experiences a child has, or the less positive experiences they have, the greater the risk as adults along the whole range of health concerns.
Can it happen at a very young age, even during the prenatal stage?
We know now from multiple studies internationally that when women are stressed during pregnancy, that has a negative effect on the child's brain development and makes the child more at risk for addiction, mental health issues, behavior problems, and so on. So really the prevention of mental health problems needs to begin at the first prenatal visit by dealing with the stresses on the woman. And we know this from multiple human studies and animal studies in the laboratory.
You incorporate your early life experiences into your work due to the trauma you endured as an infant. Is that correct?
Well, I was an infant, a Jewish infant under the Nazi occupation in Hungary, in Budapest. And my grandparents were killed in Auschwitz, and I lived my first year with a mother who was deprived of her husband, had lost her parents, and who was in daily fear for our lives. So that had a huge impact on my own development. And the day after the Germans marched into Budapest, my mother phoned the pediatrician to say, "Would you please come and see Gabor, because he's crying all the time." And the pediatrician said, "Of course I'll see him, but I should tell you all my Jewish babies are crying," which simply indicates the exquisite sensitivity of infants to the nurturing adult's emotional states. So that the child's health really depends on the emotional health and social support that the parent has. So in a society or in a situation where there's less support, more isolation, and more stress on parents, you're going to get more and more troubled children, which is what we're seeing across the Western world right now. And all these diagnoses that we're seeing with ADHD, which I've been diagnosed, by the way, personally, mental health problems amongst kids, anxiety, and so on, the increasing violence, the autism problems, these are related to stress, not bad parenting, not parents who are mean parents who are loving but who are stressed and they don't get the support they need. Increasingly, we're seeing more problems burgeoning in the childhood population.
We now use the term adverse childhood experiences, commonly known as ACEs. How beneficial do you find the use of this term? Do you think it is reductive?
It's not reductive, it's simply a statistical fact that you can't argue with, which is that an adverse childhood experience is physical, sexual, or emotional abuse, violence in the family, a parent being mentally ill, a parent being jailed, a parent being addicted, a divorce. And for each of these adverse childhood experiences, statistically, the risk for adult problems, such as mental health issues, psychosis, ADHD, addiction, autoimmune disease, malignancy, go up. Now, the childhood experiences don't explain why these things happen. That has to do with physiological and psychological development, but they provide a statistical grounding for us to know that in order to raise healthy children, we have to prevent as much as we can these adversities from occurring.
Could using the term ACEs not contribute to the stigmatization of individuals when acknowledging their adverse childhood experiences? Additionally, might it not inadvertently become a self-fulfilling prophecy, suggesting that having numerous ACEs is a predictor of one's inability to succeed in life?
No, it's not a prophecy. What would you rather believe, by the way, if you come to me as an addicted person? That you're addicted because you're a moral failure? Or you're addicted because you got this uncurable genetic disease? Or you're addicted because you have so much pain because of your childhood experiences, and if you deal with that pain, you can heal your addiction. So the adverse childhood experiences, we actually know, there's a study that showed that in a medical office, when people are asked about their childhood experiences like that, they visit the doctor, they have fewer doctor's visits later on, because just the fact of being listened to and having their experiences validated makes them less prone to get ill. So this is not reductive, it doesn't stigmatize, it simply helps people understand their experience.
How do we best support people who have suffered from childhood trauma?
First of all, by not just people who have suffered tremendously in childhood, whose addictions, whether it's to sex or gambling or shopping or drugs or alcohol, the 4,000 or 5,000 people every year in Scotland who die because of alcohol-related diseases. What if we didn't see them as derelicts or as failures? What if we see them as people who've suffered and who need support to heal their suffering, and then maybe they can give up their addictive habits? This is a universal problem, but the main problem is that the average medical student in Scotland, and Scotland is a great medical tradition, as we know, but in Scotland, in the UK in general, in North America where I work and teach, the average medical student doesn't even hear the word trauma once in their training. They don't get a single lecture on the impacts of trauma. They don't get a single course on how to correlate people's life experiences with their illnesses. And so that not only do we have limited time, we also have limited education. And this is not the personal failure of individual physicians. This is a systemic failure that we have a very narrow view of disease and of human beings.
Do you think that childhood trauma is linked to autoimmune diseases like diabetes and cancer?
There's a strong statistical correlation, and we have this scientific knowledge to show the relationship. Because, for example, the more trauma you experience, the more stress you can experience in your life. Stress diminishes the immune or suppresses the immune system, and it deranges the immune system. And so that, yes, the more childhood difficulties you have, the greater the likelihood of you having rheumatoid arthritis, which also means that when you see the physician for rheumatoid arthritis, it's not enough that they give you pills for the inflammation. They should also talk to you about the stresses in your life. I know people who've had multiple sclerosis, who are typically people who learned in childhood to suppress their emotions as a way of fitting into their families, and therefore they become very nice and people pleasers. And when they realize that they don't want to be that way anymore, all of a sudden the multiple sclerosis gets better over time. And there's been studies showing this in rheumatoid disease. I mean, the whole problem is that we're not looking at the evidence. Western medicine, for all its amazing achievements, and I'm a Western-trained medical doctor, I know how powerfully effective our methods can be. But when it comes to chronic conditions, because we separate the mind from the body, we are not very effective.
Are you saying that everybody that gets these diseases has had trauma in their childhood?
You know, I don't want to be dogmatic about it, but I can tell you that somebody with autoimmune disease, for example, I've yet to meet somebody or read about anybody who was not suffering from a combination of emotional and physiological problems. I mean, here's the reality. You can't separate the mind from the body. Physiologically, it's not possible. There's lots of evidence published in medical journals. The relationship between stress and disease, the relationship between early childhood experiences and disease, the way that emotional factors affect the immune system. People have been studying this for decades and decades and decades. And so what I'm saying is that the Western medical mind is trained not to look at certain evidence that it doesn't feel comfortable with. And let me quickly throw in one more thing, which is who funds medical research? Pharmaceutical companies. There's no profit in studying this because you can't make pills for stress.
If you could trace back to a person's childhood, and they are now suffering from multiple sclerosis as a result of trauma, Would you give them therapy rather than drugs?
I didn't say rather. If somebody needs medication for their multiple sclerosis, they have a flare-up, of course they should have their medication. But once you're feeling better, let's have a conversation. How stressed were you before your flare-up? What caused the stress? What was happening in your work? Did you take on too much? Did you have trouble saying no? Was there a marriage difficulty? Can we deal with that? Can you learn how to be more effective in dealing with your stresses and maybe prevent the next flare-up? So it's not a question of either or. I'm not saying we should throw out Western medicine. I'm saying it's missing a huge part of human experience that if we added it, our medical practice could be so much more effective. As you suggest, that would take more time, but it would also promote a lot of health.